So you talked a bit about kind of the impact on outcomes and experience on racialised communities, both under the COVID pandemic, but also in mental health services, as highlighted by the recent CQC report. How do these kind of inequalities actually affect individuals and communities in the spirit of mental health?
The impact of this is huge, it's profound. Discrimination, stigma, mistrust, the experience of individuals who feel sometimes healthcare professionals aren't understanding their needs and therefore the intervention isn't the right intervention. It's huge. So there's so many layers to it. It's multifaceted, and I think that's why, in terms of trying to pin down inequalities in one place, isn't the answer, and hence the framework is multidimensional as well. And when patients or carers do access the services, when they finally get there to be able to, navigate through the different experiences that we've been told they've had, the services fail to meet their cultural and emotional needs. So this leads to poorer outcomes.
Yeah, of course. Have you got any evidence or statistics that give a kind of flavour of the impact that this can have on individuals and on communities?
What we know from, there's a plethora of information evidence, and you've mentioned the recent CQC report. We know that individuals from Black communities are more likely to be detained under the Mental Health Act, 3.5 times more likely than those from white backgrounds. People from the South Asian community, there's a lot of stigma attached around to mental health and diagnosis, and often this then leads to late diagnosis, and there isn't a door for those individuals to go to, or families, because of the stigma. And we've heard many ethnic minority groups reporting that they're just not understood, or again because of the lack of cultural competence or being able to translate some of those services specifically. There's a huge amount of statistical and evidence, and even the experience tells us, feedback tells us that there's just a low level of attention to these racialized communities.